Single tooth implants are probably the majority of what we do. I bet you we average 4 to 5 of them a week. A lot of them are immediate placement, super straightforward. We have 3 different types of one-piece implants available in our arsenal to do those. We also still have the traditional implants. Even though I haven't placed a single one for 3 years since I became an implant center, just because I really feel the one-piece implants are really our future in dentistry. We place the implant post-extraction, and then we splint that, meaning we place the covering over top of the implant, and that wedges in between the teeth on each side of the space, and that holds the tooth in, or holds the implant in position so there is no micro movement. Micro movement can inhibit the bone integrating or the bone growing and attaching itself to the implant. So we believe in splinting that implant, especially with an immediate placement, just to keep that implant completely stable and not moving. And of course, we ask you to chew on the other side of your mouth and make sure you chew softer foods, at least for the first 4 weeks.